Hi, it's Leo Sarkissian from the Arc of Massachusetts. Happy to be with you, sharing some news. July 2023, the release of a new statistical report from the Centers on Disease Control and Prevention, which found an increase between 2019 and 2021 in developmental disability. They actually define developmental disability in this survey as autism spectrum disorder, intellectual disability, and other developmental delay. So three big groupings. They don't worry about federal definitions and different definitions of ID and DD. What they're trying to do is give a simple way of reporting on a category that they call developmental disability, and probably makes sense. The incidence grew from 2019 to 2021 among 3 to 17-year-olds from 7.4% to 8.56%. So this study focused on youth, which will help us, looking at the future. It is a great window on what's evolving in our country in terms of disability and developmental disability in particular. Boys scored higher than girls in terms of incidence, and specifically in terms of incidence of autism spectrum disorder, boys were 3 times more likely to have it, according to this report in this survey. And finally, youth of Asian origin were less likely to have any developmental disability than other groups, whether they were non-Hispanic white, Hispanic, or non-Hispanic black. Those were the comparisons that were made. Finally, a couple of key points as we talk about this report. It's out of the CDC, their National Center on Health Statistics. We'll have an article on The Advocate about it. It's a newly redesigned survey, so you can't really compare these findings to the ones from 2014 to 2016. I mean, you can, but you can't directly compare them. And then finally, I just want to point out that they don't use the traditional definitions, as I said earlier. And again, I think that's okay, because what they're trying to do actually is show an incidence in the most defined way possible among potentially 3 different types of groups. As you know and I know, someone may have ASD and ID, someone may have a developmental delay and have ASD. So you really, it's a good way for the center to do the statistics and the reporting. Anyway, that's it for today. Hang in there. Looking forward to talk to you again next week. Take care.